Catherine. There we go. And I'm going to be introducing Dr. Robert Hedaya. He is the founder of Whole Psychiatry, WHOLE, like Whole Foods. And he's really a pioneer and a medical detective. And that is why for over 40 years in practicing as a neuropsychiatrist, people have come to see him from around the country. His office is in Eatontown, New Jersey. And I'm going to turn it over to Dr. Hedaya. And if at any point you have questions, if you can raise your hand, or if you need to, just do this and we'll call on you and take your questions. And we'll also have time at the end for questions. So welcome, everybody. Enjoy.
Okay. Has anybody been on our previous Eventbrite talks? I'm just wondering if there are any repeat offenders. Patty, okay. Okay. All right, nice to see you. All right. So we're going to get started now. I'm going to share my screen in a second here.
This on.
I put this on.
There we go. Okay. Let me close this thing out here. There we go. All right. So I'm originally trained as a psychiatrist, board certified by the American Board of Psychiatry and Neurology. And really, how does a psychiatrist end up treating Parkinson's disease? It's a long story, but the short answer is that basically I'm a medical detective and I follow the lead and the lines and the basic science, and I look for solutions for my patients. I very rarely say I can't help you. I'm always searching for solutions, and eventually found solutions for patients that I had who have Parkinson's. I do not advise people to stop their Parkinson's medications, but we are able to actually improve significantly their response, heal their brain, and help them avoid going up on medication. And tonight, what I'm going to do is talk to you about exactly how we do that. Well, I shouldn't say exactly because that would be like a 5-hour talk, but I'm going to kind of give you the overview. Okay, so let me get the slides. Don't want to go. There we go. So the first thing here is that this is the first thing to notice, that all of these diseases here, Alzheimer's, arthritis, traumatic brain injury, allergies, asthma, cardiovascular disease, all the things you hear about all the time and you think about, and metabolic syndrome, infections, toxins, all of these things actually co-occur in people who have Parkinson's. Now, not every patient with Parkinson's has all of them. They usually have, 2 or 3 of these, and these are part of the pathway to Parkinson's. And so what we're going to do today is we're going to talk about a couple, 2 or 3 of these pathways. We can't really cover them all, but it's important to understand these same things here are also related to other forms of dementia, to cardiovascular disease itself. So, the chronic illnesses that we suffer from in this country, in the Western world, really have common underlying pathways that affect different parts of the metabolism and the psyche, and et cetera. So this is a functional medicine matrix. And the people who have been on before may remember it. We're looking here at different nodes. See here, food, gut function, immunity and inflammation and infections, energy production and mitochondria, toxicities and nutrition, cardiovascular factors, hormonal factors, brain networks, head trauma. And then these are all the nodes, different kind of, let's say, metabolic systems in the body that affect one's mental, emotional, cognitive, spiritual functioning in the center of this square here. So these are the different nodes in the metabolic matrix that we use in functional medicine, and we apply this to lots of chronic illnesses. Tonight, we're talking about Parkinson's. We then look at antecedents, meaning what are the things that came before, and then triggering events, what triggered the Parkinson's, and things that actually perpetuate and maintain the disease state and promote the disease state so that it continues to advance and impair your life. And then on the bottom, we look at basic factors in life, lifestyle factors, sleep, relaxation, exercise, nutrition, stress, relationships. So that's the functional medicine matrix developed. I helped develop this at the Institute for Functional Medicine probably about 12, 13 years ago. And so that's what we use that's the mental map in a way or one of the mental maps I have in my mind when I'm seeing someone. And so what we do is we try to focus on this, and we want to start by identifying root causes of any chronic illness. Again, in this case, Parkinson's. So tonight we're going to talk about a few of these root causes. One of them is the immune system. If I kind of go back here, you'll see here, you see upper right here, immune, inflammation, and infection. So your immune system gets activated or suppressed by bacteria, viruses, mold, infections, chronic infections, various assaults to immune system. And you can also have genetic vulnerabilities to abnormalities in your immune system. And just as an example, your immune system will not function properly if your adrenals, that would be on the hormones here, if your adrenal glands are not functioning properly, then the result is your immune system will not function properly. So when we're looking at these nodes, what I realize and come to realize is that all of these things are actually interconnected. I can draw a line from every one of these things to every one of the others. It's a systems approach to biology. This is not a linear way of thinking. It's a systems approach. So I might treat someone with these hormones because I want to help normalize their immune system, for example. Right? So let's go forward here again. And we're talking about infections in Parkinson's. So the question is, okay, you've got Parkinson's disease. What caused it? Well, there's a good amount of data, and you see here's a review in a major journal showing that inflammation and neurodegeneration occur together. And this is a very interesting interplay in Parkinson's disease. And here, this is a quote from this paper. There's no doubt that pro-inflammatory immune-mediated mechanisms, meaning inflammation, is pivotal to the pathogenicity, meaning the disease process and the progression of the disease. So inflammation caused by whatever it's caused by actually causes or helps cause the disease in many people, and it helps the disease to progress. So that's kind of actually a nice thing, because all you have to do then is identify the sources of the inflammation, treat that, and you've actually removed one of the things that is pushing the disease into progression and worse. So this is very, very important. Now, this is just one paper. There are many papers. Here's some review of different pathogens that are associated with Parkinson's, and there are others, because the truth of the matter is any chronic infection that causes inflammation, and chronic infections all cause inflammation, will cause changes in the hormonal and the immune molecules in the brain and in the body. So the truth of the matter is, if you really had the resources to do the study, you'd find that any chronic infection will contribute to the progression and even one of the causes of Parkinson's disease. Toxins are another cause. So here's a paper from 2022 in a national journal. I think this one was in Nature, but I can't really see. Um, but this is basically, and there are lots of papers on this that show that pesticides and other toxic chemicals are directly toxic to dopamine neurons. Parkinson's disease, if you know, is a disease of the dopamine neurons in the brain, particularly the substantia nigra. Now, there are four different areas in the brain that produce dopamine and use dopamine to function. And the substantia nigra, which connects various pathways to the motor cortex for movement and the cerebellum, et cetera, those neurons are particularly vulnerable. And pesticides, and there are many, many other chemicals that are involved here. For example, one person I know who treats people for Parkinson's told me that she was running a group for Parkinson's patients, and that there were 20 people in the group, and 5 of them actually lived over a dry cleaner. So the dry cleaning chemicals can do this. And the other thing is, we don't really know how all of the chemicals interact with each other. So there's an interaction when you talk about toxins between all of the new to nature chemicals and the other chemicals, meaning they interact with each other, plus they interact with the genes, and plus they may be interacting with mold toxins, which are quite common in this, well, most parts of the country, really. These are quotes from the article that I'm showing you. It's basically saying that the evidence strongly supports a causal relationship, meaning it's not just an association, it's a causal relationship between environmental toxins, especially pesticides, and Parkinson's. Additionally, heavy metals, mercury actually will prevent your brain cells from expanding and growing. The mercury binds to something called tubulin, and tubulin is like if you had a Lego set, it's a Lego that helps the neuron grow longer and longer so you can develop new neurons and branches, form new memories, etc. Well, the mercury stops the Lego blocks from binding together and building. So mercury, which is high in tuna, most types of tuna, and then there's heavy metals like lead that can also play a role, and excess iron can play a role, etc. So then you have all of these toxins, including mold toxins, specific mold toxins that interact with your genes. And so the genes kind of really load the gun, and you might have one bullet or 5 bullets, but it's really the environment that pulls the trigger. Again, here are the diseases. I want to talk about another pathway here that you see here. I hope you see my cursor. You see thiamine, vitamin B1 here, right? We're going to talk about thiamine. Actually, what I'm going to do is I'm going to actually stop my share for 1 second and pull something I want to show you. Where? Okay, now I'm going to share my screen again here. Okay. So this is long-term treatment with high-dose thiamine in Parkinson's disease. There's a study that was done a long time ago. I don't have the year, 2015. There it is. And this Dr. Constantini, the first author here, actually ended up treating about 2,500 people. This was just a study of 50 people with Parkinson's, but over time, he actually treated more than 2,500 people. And here's his conclusion, and I can echo this in terms of what we do. The thiamine treatment led to significant improvement of the motor, non-motor, meaning your movements and your initiation of movements and your tremors and balance and things like that, and improved this widely accepted measure of Parkinson's disease. It's a test from 38 to 18. That's basically a 50% improvement within 3 months. And this remains stable over time. Okay, that's pretty significant. The motor score that improved from 22 to under 10. So it's more than a 50% improvement. Some patients with mild Parkinson's had complete clinical recovery. And the clinical improvement is stable over time in all patients. So this is quite striking, and this means that the thiamine is actually involved in a pathway for Parkinson's, specific pathway. And replacing thiamine, the really ideal way to do it is with injections, specific type of injection. But replacing the thiamine actually does stop progression and help it with improvement. So this is another pathway which is really not addressed in standard neurology. I'm not throwing standard neurology under the bus, by the way, because the Cinemet could be very helpful. But by the time people come to me, they're generally on Cinemet. And so I don't change that, but I attack these other pathways so that we can actually push this disease back and create significant, meaningful improvement. I'll stop my share for 1 second, and then I will go back to the slideshow. Okay, let me share the screen here. Okay. Now, this is a woman I wanted to show you with real data. There's only one woman. We've had results like this in 2 people. This is a woman who, on the left here, you see she's 61-year-old female, and she did this test. This is a MRI of the brain. It's called a neuroquant MRI. And what we do is this MRI can actually show us all the parts of the brain, the specific areas of the brain. So they're kind of listed on this slide and on another slide that you're going to see shortly, different parts of the brain. And what you see here, when she started before treatment, her overall gray matter, meaning the surface of the brain, excuse me, where you do most of your thinking, was in the 19th percentile, meaning 80% of people actually had better gray matter than she did. And after 2 years, she was in almost the 40th percentile, which is completely in the normal range. So her gray matter grew back. Okay. This woman, when she came to me, had such a bad tremor that she actually couldn't even turn the turn signal to get to the office. And those symptoms disappeared completely. Now you see on the bottom here, these are areas, it's called the pallidum. Overall, the pallidum here is about 24. You probably can't read it because I highlighted it, but it's 24 percentile, meaning about 75, 76% of people have a bigger pallidum than she had. And the pallidum is closely related to the substantia nigra. Okay, the pallidum, it's in the basal ganglia. And here you see after 2 years that she's in the 38th percentile, which is normal. So she's basically improved by about 15 points. It's about a 60% improvement. So basically, you always hear, I think, well, I certainly do, that the brain is very plastic, meaning it changes and it can grow. Well, we're showing here that her brain actually grew back. In the course of treatment with her, we did a couple of things, hyperbaric oxygen, neurofeedback, and this is what she sent to me. She said, I had my neurofeedback and I feel some of my motor skill issues have improved. So oftentimes we target a specific network. There are a few networks. One of them is the skilled motor movement network. Here's another part of her MRI, before and after. On the left is before. The same with the pallidum. It improved significantly. The parietal lobe here, which is 24.57 here, is 41. So you can see these improvements. All the abnormalities went away. She was within the normal range, well within the normal range. So I say this to give you hope to understand that the brain really can heal. This is why we call it the Brain Recovery Center, because the brain does recover. If you do what you have to do, it recovers. All right, let's see if we can get the slide to move. I'm going to stop the share again. There we go. Okay. All right, let me go here. All right, now we're going to talk next. We're going to talk about another angle of healing here. And it's called photobiomodulation, which is basically photo meaning light that modulates the brain. And this comes in different strengths. There are very weak helmets that people use for affecting the brain. It's hard to say for sure how effective they are. There are studies that show that they are effective, but the studies are funded by the companies that make the helmets, which always, so we're waiting for an independently done study. But they use about a half a watt strength. We use lasers that are up to 30 watts. So that's up to 60 times stronger. And it's painless and non-invasive. And how does it work? It works by only about 2.6% of the light goes through the skull and the hair and all the layers. But what it does is it releases energy and increases blood flow and nerve growth factors, and it actually reduces inflammation in the brain and clears out debris. Like if you've heard of amyloid protein in the brain, it actually clears amyloid out of the brain. So it does a lot of things, and with the laser, we can actually get wonderful results. So that's what we are doing now. Here's a study in Neurology, mainstream journal, a double-blind sham controlled study, meaning a double-blind placebo. People who the patients didn't know that they were getting no light. They thought they were getting light, and they found clear improvements. The efficacy among completers of the trial, there was a significant improvement in this UPDRS motor scale, which is the standard scale for Parkinson's I had mentioned before. For those who switched to the active treatment, they tested 40 people. It's a double-blind, placebo-controlled trial, which is it's a strong trial. We could have used a higher number of patients, obviously, but this is consistent with what we see in our office, in our clinic. This is an example of, so this is a quantitative EEG. We do this on everybody. And it's basically, if you've seen an EEG, you put the cap on your head and there's all these electrodes that measure the electricity in the brain. And then it's really a form of AI. Well, all that information is taken in to the computer and processed. And it's absolutely incredible because it can show us all kinds of things that are actually going on and how they're functioning in your brain in real time. And MRI is the structure of the brain, but this is actually the function of the brain. And so we can look at all these different networks in the brain and the deep nuclei in the brain and the surface of the brain. And it's quite amazing. We do it in the office. It takes about an hour. It's painless. Or we can do it in someone's home. We send the equipment to their home. So that's what we do. It's called a quantitative EEG, and we use this to guide our laser to where we're going to apply the light. So this is a patient who had Parkinson's, and we were targeting the skilled motor movement network. And you can see all the blue here means these connections between the right here and the left here are very, very slow. This blue here, the dark blue, is very, very slow, and the light blue is slow. And this is the brain right here. And you can see this is information flow. And you can see the information flow, it's really coming from back here, is very, very slow, and which means basically very inefficient and makes life hard. It makes functioning hard. Here's a look at the surface areas of the brain in this person. And you can see really the surface areas are all normal because they're gray, but blue or yellow is abnormal or red is abnormal, et cetera. This is before the treatment with laser, and this is after in the same network. You can see the brain is almost completely cleared here. and so is this. Now, if someone came into me just with a QEG of this on the right here, it should be all black, but like this, I wouldn't even bother doing anything. And so this is a pretty impressive effect of the light. And this is someone before treatment who had Parkinson's. And here you see the yellow and the kind of red areas. These are overactive. And the blue areas here are underactive. Now we can actually, I can't show you this now, but I can actually tell you exactly what these pathways do, each one of these pathways. And so we can isolate them and we can actually treat them directly and specifically. You can see here the surface of the brain in this person is yellow, it's overactive, it's unstable. It's also in the frontal area of the brain here, and it almost looks like a head injury here. And then here we have another view. And you see all these pink areas right here. Those are the surface areas of the brain that each has a number. And you can see there's a lot of surface areas of the brain that are overactive, which is what you see here in this picture here. Now here, 4 months into treatment, all the pink areas are gone. The surface of the brain completely normal. And you notice the connectivity is like, I don't know, 90% normalized, right? And that's 4 months after treatment. It's the same thing, just a little bit bigger slide. And this is a person who had Parkinson's disease, hypomania, meaning overactivity, and a head injury. You can see how the brain, if you just look at these lines here, you can see the brain is almost like, wow, it's so busy. It's just like supercharged, which is not good. And you can see it's mostly in the frontal area here, right here. And then this is after the treatment.
Talk about what the lived experience would be.
This is after the functional medicine and hyperbaric oxygen. So what is it like for patients who go through this? I would say that people notice, well, it depends on the person, how far along they are, but for one guy, I'm thinking about, tremors, abnormal movements, mostly gone, anxiety, depression, pretty much gone. What other symptoms did he have? I mean, he doesn't even notice his tremor anymore. I have the woman that I told you about, who couldn't drive, barely could drive to my office because you couldn't put the turn signal on, was completely normalized. I mean, her life was normalized completely. And I have another guy who I treated this one actually 5.5 years ago, and he was diagnosed with Parkinson's, and through the NeuroQuant and the QEG, I determined that he actually didn't have the disease. He had Parkinson's syndrome, meaning a type of Parkinson's, but it was really from a head injury. And the history was that he fell off a bike twice, the same exact spot on his head, which turned out to be the motor cortex. And he was terrified of his Parkinson's. People are terrified that they're going to deteriorate. But my message to you is you don't have to deteriorate. There are treatments now,
There's a question.
Let's see, we got a question here. Let's see.
I can, do you want me to?
Let me just see. I think that's my last slide. Let me make sure. I guess that is my last slide. So let me take some questions.
Gabrielle.
Gabrielle, you can unmute yourself and ask your
You
question.
can unmute them. Unmute her.
Well, I have
You
to,
could do it.
let me see, where's
Just-
Gabrielle?
She's up here.
Okay, there you
Unmute,
are.
unmute her.
Unmute. Oh, Gabrielle, you have to unmute yourself, it looks like.
Okay.
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 Yeah,
Can you hear?
yeah.
No. We had a question. Can this procedure be done on somebody who has deep brain stimulator?
If it's, well, some of it for sure. The question is, what is the deep brain stimulator made of? Number one, is it metal? How deep is it? And I haven't done it. I'd have to consult with the, find the technical. But the only thing that I have question is whether the laser could be done. But all the other treatments can be done.
The laser, yeah, that was our question.
Yeah, all the other treatments are fine.
When you have the deep brain stimulator because of magnets and I don't know, I don't have the knowledge, but I know it limits you for a lot of things.
Yeah, so it depends. So for example, it depends where it's implanted and where's the entry point, and depends what we see on the QEG. For example, well, if you think back to one of the images, you see there was a lot of dysfunction throughout the brain. So let's say you had a deep brain stimulator on the left, but there's pathology or abnormal communication or whatnot on the right or in the frontal areas, then that would be fine, because the penetration of the light is actually only 1 centimeter, right? But I would probably, unless it's made of plastic, if it's made of plastic, it's another story. I wouldn't have a problem. But my guess is there's some kind of metal in there. So I'd have to look at that. So,
Okay, thank you.
okay.
Ask other.
Anybody else have a question?
No baseball, no soccer players, no strip. Fuck, strippers ain't got the
Hey,
coronavirus.
could you mute yourself? Mute.
Get ass in front of.
Okay. Okay, good.
I have a question.
Yes.
What is the dosage and frequency of the thiamine?
So the dose varies with the person. It could be 75 to 100 to 125. Frequency would be once a week or twice a week.
And is that by injection or can you
By
take
injection,
it?
it's by injection. And if you want your doctor to do it, you can write this down. The name of the doctor is Constantini.
I wrote it down.
Constantini, okay? And he could look up the information, okay?
Thank you.
I have a question.
Yes, Suzanne.
Have you ever had a patient come off of Cinemet completely? Even though I know you don't recommend it, but has it ever been?
I think I would say it's possible. I haven't done it yet. My first patient was 5.5 years ago, but then a lot of this was interrupted with COVID, right? So it's not like I have 50 people, because we just started doing it originally, working into it in 2017 with various conditions, not just Parkinson's. And so the reason I'm giving this is because the results are just so consistent that I'm getting, but I don't feel like I have a long enough period. And the guy from 5.5 years ago was never on Cinemet.
Oh, have you
I
ever
would think it's possible at least to lower the dose, is what I think.
right? Have you ever treated somebody with who's taking a lot of Cinemet?
Yeah, I mean,
Or-
yeah, for sure.
And they still take it? Okay.
But
So it's
what I'm
something-
saying to you is that's a question they'll probably be able to answer in a couple of years.
Right. Okay.
There's a question
Thanks.
in the chat.
A question in the chat. Let's see, what's the question in the chat? I don't see a question in the chat.
I'll give
Where's
you
your hand, Judy?
Oh,
treatments.
I'm Judy Cabral.
Oh,
Okay.
Oh, anyway, my question is, I live in Rhode Island, so how would we be able to navigate all this?
Well, what you'd have to do, so let's assume that basically you'd have to be visiting here, okay? You'd have to be visiting here. Now, if it looked like the laser made sense for you, then you'd probably have to be here for, could be a month or two. We have people come for 2 months, 3 months, 1 month, et cetera. Then you say, okay, great, but what if I need maintenance treatment? Then what? And the answer to that is we don't know who needs maintenance treatment and who doesn't yet. We can't predict it. So I have one guy who I treated, who he did everything I asked him to do, which is essential. And it's not so easy. The diet is not easy. There's a lot to do for most people. So we did the laser treatments, I think, for about 6 weeks, and his brain improved remarkably. We stopped the treatments, and then we waited 6 weeks. We repeated the the QEG, and his brain actually improved even further. On the other hand, I have a woman who, well, I'll take another guy, a different guy, who we treated his Parkinson's. He did really well. It was doing great. And then he was traveling for about 6 weeks or so. We repeated the QEG, and he actually deteriorated. So some people, it's like you've done what you have to do, and they're good to go, you know. And then some people, they need maintenance. So that's becomes a bit of a problem.
Now, our daughters live in Philadelphia. How far away are you
Yeah,
from?
Philadelphia is, I have patients who come from Philadelphia. And typically, you'd be coming once or twice a week, for the laser, if you need the laser. And visits could be in the beginning, like twice a month or so, something like that. And then over time, over 6 months, say they slow down.
Where are you located?
We're in Eatontown, New Jersey, which is about 10, 15 minutes from Asbury Park, if you know Asbury Park.
Yeah.
And how far is that from Philly?
I think about 2 hours or a little bit under 2 hours,
Okay,
depending on traffic, of course.
right.
Mhm.
Yeah.
Patty.
Patty?
Thank you for taking my question. I apologize that I'm not on screen, but I'm on the floor, standing up, just getting down to move because it's that time of night when it gets really bad.
Uh-huh.
Typical, you answered some of the questions with the woman that you just spoke to, but typically it's a diet and change of routines, I'm sure. And it's like 2 times a week, maybe. Are there people who have been more? I'm just trying to coordinate with people who would have to bring me because I don't have to drive anymore.
So for the laser, typically, let's say 2 times a week. I don't think it could happen that it's 3 times a week, but I rarely do people 3 times a week. It's
And
usually
you're off,
2 times a week.
and you're like daylight 9 to 5 type of a setup.
Typically we start around 9:30. The last
Okay.
appointment ends around 3:30.
Right.
And then, there's other things. We do hyperbaric oxygen. Sometimes, for example, in your case, if you came and if you needed it, not everybody does, but if you needed hyperbaric oxygen, you'd want to find either someone near you who does it, or you'd purchase a chamber in your home. It's small enough to be in most homes, but it can cost you. You don't buy it from us, but it can cost $12,000-13,000. And if you have a HSA, that would be covered, right? If you do it if you're local, then you could come into the office and do it in our office.
I am. This is the first I've been hopeful in a long time. I'm very impressed with your research and with your sharing. Thank you so much. And you had asked a question. I didn't listen fully, which is some of my problem. You had said, did I ever attend your lecture? I attend something else with Eventbrite with the Brian Grant, not your lecture. I apologize for the misinformation.
Okay, so I think we have one repeat person. Okay.
Very hopeful. Thank you.
Yeah.
Nice to have hope again.
Yeah, well, you know what? I would not give undue hope. And the only reason I'm doing this is because I'm literally blown away by this. And we're actually working on getting an IRB to do this in a bigger way. So we'll see. And there's a lot of people. So it's very prevalent around here in this.
It sure is. A lot of people suffering. I belong to a choir, Parkinson's choir, and people are really suffering.
Yeah.
So,
Yeah.
you know,
Yep.
thank you so much.
You're welcome.
Okay, Gabrielle has a question.
Gabrielle?
Ask her.
Yes. So we had a question. Is these the injections or the laser, are they mostly good for the tremors or also for somebody who has the type of Parkinson's that is more of the rigidity and the slow movement?
So the slow movement, we have some other things that might be able to help for that. I would say the movement improves for sure with the laser and the hyperbaric, because we do these treatments together so often. I can't separate it out for sure and tell you, but they help tremors, they help movement, they help walking. and the gait and the shuffling becomes less, and the bradykinesia is reduced.
Thank you.
So there's a question, any negative side effects to the thiamine or the laser? So the thiamine, you have to adjust the dose properly, because if you don't have the right dose, people could get worse. The laser, we have to do an MRI before doing the laser, make sure there's no reason to avoid the laser. So maybe you have a cyst, maybe you have a vascular problem or something else. We definitely always do a MRI to make sure that it's safe. And then the side effects are very minimal. If you have a bipolar disorder, then it could activate you. You could get agitated or activated. So that needs to be under control first. But if you have depression, it actually helps depression, helps cognitive functions. People can get a little bit of a mild headache, very mild, and doesn't last long. That's actually a good sign. It means increased blood flow. And that's like pretty much it, really. Patty,
Yeah.
I can't hear you. I think you have to unmute yourself, Patty.
Thank you. Thank you, Gabriella, too. You triggered another question. Does it help with people that freeze a lot, these treatments? I have minimal tremor except at night, but I have a lot of freezing during the day.
I think it can help with freezing. Maybe not completely, but definitely reduce it significantly.
And do you take insurance? I hate to be so specific.
Well,
but do you
no,
take
that's the question. And the answer is no. The answer is no.
Understand.
I mean, so it's expensive for a variety of reasons. I will tell you that basically my income hasn't changed in 20 years, but my expenses have certainly gone up a lot.
Sure.
And so it is what it is. The truth is, it's the only way that I can actually practice this medicine. This type of medicine is outside of the insurance system. It's impossible to actually get a code for an evaluation that lasts 3 or 4 hours, for example.
I understand. Same is true with acupuncture and a lot of things that work well.
Yep.
Thank you.
You're welcome. Len?
Is there anything you can tell us about diet?
Well, diet is specific and general. You have to, in a general sense, but you're always very important to have like a zone diet. You can look it up, Barry Sears, the zone. But there are specifics for people. There's food sensitivities that cause inflammation. There's, immunological reactions based on genetics that cause food reactions. All right. Well, if there are no more questions, then we will sign out. In a couple of weeks, I think July 22nd, we're going to have a Eventbrite on OCD. So if anybody's interested in that. Gabrielle, did you have one other question there, or? You got to unmute yourself. Can't hear you. And I can't read lips, so that's not good. Let me see if I could unmute you or put in the chat. Put in the chat, Gabrielle. It's not really working. I don't know why. Okay.
Oh, okay. So you mentioned it's not covered by insurance, and I was hoping Patty was going to ask what is the approximate cost of this type of treatment if it's not.
Yeah, so it depends on the complexity and of the situation. So let's just say the worst case scenario is you have mold in your house, you have to remediate your house, right? So I had someone who had to remediate their home, and that cost them like $200,000. I was small potatoes, right? If that's the worst case, right? The best case scenario would be probably you have minimal stuff going on metabolically, and you really just need QEGs, hyperbaric lasers, appointments, some testing, et cetera. So let's say over the course of, the first year, maybe $25,000.
Okay, thank you.
Okay.
All right, thank everyone.
All right, everybody. Thank you for coming on and your questions. And I'm glad at least now there's a lot that can be done. All right.
Thank you so much.
You're
Thank
welcome.
you.
Thank
Thank you
you.
very much for your time.
Take care.